Welcome to this year's online programming at the Worth Institute. My name is Alexandra Rokviti and I am a PhD student at the University of Graz in Austria. My PhD is in the field of medical humanities and cultural studies, and I'm dealing with endometriosis and the social taboo surrounding menstruation. So basically, my dissertation is viewing the menstruating body in cultural and social context. Now, I had the privilege of presenting for the Worth Institute last year, and you can find my previous lecture right here on the Worth Institute's YouTube channel. And last year, I focused on the differences between observing an ill body from a medical point of view and a cultural point of view, and I focused on endometriosis. This year, I am once again talking about endometriosis, but I am focusing on mental health and, to be more exact, on the correlation between endometriosis, mental health, and work productivity. I think this is a very important topic in today's world, especially in our modern society, which is largely capitalist. And I truly believe that everybody who is in any sort of authoritative position, leadership position, managerial position should be aware of endometriosis and should be educated on endometriosis in order to be able to provide a safe and effective working environment for their employees. And I hope that by the end of my presentation, I will have convinced you of this as well. So without further ado, let's dig in. So what is endometriosis? Endometriosis is a condition characterized by the presence of functioning endometrium-like tissue outside of the uterus, which induces a chronic inflammatory reaction. It's hormone-dependent, chronic inflammatory gynecological condition that causes pelvic pain symptoms impacting the physical, mental, and social well-being of reproductive aged women. So this is the definition, but what it basically means is that the tissue, the endometrium, which is normally found inside of the uterus, has been displaced and can be found on other organs inside of the body. Usually it's the organs inside of the pelvic cavity, but they can be found virtually anywhere. Endometriosis has been found in the brain, in the lungs, everywhere other than the spleen. And this is a problem because that tissue then acts in accordance with the menstrual cycle, so it follows the fluctuations of the hormonal nuances of the menstrual cycle, and this causes an autoimmune reaction from the body. And this illness affects 1 in 10 women, so every 10th female has this condition. So this is not something rare. It is actually something very present in our lives, in the lives of all of us. Now, the symptoms of endometriosis are severe dysmenorrhea, that's abnormally severe uterine contractions during menstruation, chronic pelvic pain at any time of the cycle, ovulation pain, neuropathy, that's nerve pain in lower extremities, bowel and urinary disorders. This can mean irregular and painful bowel movements, and urination with or without bleeding is the leading cause of infertility, and it causes major chronic fatigue. Accompanying conditions are appendicitis, thyroid issues, irritable bowel syndrome, any kind of allergies, premenstrual dysphoric disorder, and anxiety. What I mean by accompanying conditions is that research has shown that when you have endometriosis, you also have at least one of these other issues or conditions. Now, I'm sort of flying over all of this because, as I've said, I've dedicated last year's lecture to explaining all of this in much greater detail. What is important to keep in mind when we talk about endometriosis is that it's called the invisible illness. The problem that people who suffer from endometriosis face on a daily basis in forms of discrimination all stem from the fact that they don't actually look sick. And another bad, quote unquote, thing is that because the mechanics of the illness, the fact that the misplaced tissue reacts to hormonal fluctuations, the symptoms are the worst during menstruation. So this pain that is experienced is then attributed, it kind of feeds into this whole hysterical woman myth and is very easily dismissed by others. So society at large dismisses it as just a painful period and a woman overreacting. And lastly, what has to to be mentioned when we talk about endometriosis is that diagnosis is the biggest issue. Diagnosis is very difficult to come by and takes an average of 6 to 8 years in the Western world. And the reasons for this are both medical and cultural. Now, as I've already said, my previous presentation is largely focused on this, so on medical versus cultural difficulties in diagnosis. So I won't go any deeper into any of this now, but as I said, I do invite you to check out my previous lecture. Now, what I do want to talk about this time around is mental health. Because we're talking about a physical illness, most research has been focusing on the physical experience. But what about the connection between mental health and endometriosis? This is something that needs to be discussed and looked into. First of all, common sense just tells us that living with chronic pain or any sort of chronic illness can cause an individual a lot of stress. And in recent years, this has become a topic of interest for researchers. It emerged actually quite naturally. Once research started being patient-based, a lot of new aspects of the illness came to the surface, and one of these aspects is the mental strain that living with endometriosis puts on a person. I'll go on and tell you a lot of numbers, a lot of statistics. These statistics have been taken from various international research, most of it conducted by or supported by big organizations, such as the UK All-Parliamentary Group on Endometriosis, the European Society of Human Reproduction and Embryology, the Department of Biomedical Informatics at University of Columbia, and the Endometriosis Foundation of America. Now, at the end of this presentation, you'll find a slide with all of the research listed, all of the authors and everything. So for the sake of coherency, I won't be pointing out who said what while I'm talking, just so that the lecture is a little bit easier to follow. So basically, research has shown that endometriosis patients are at high risk of developing depression or anxiety disorders, or both, as a result of the illness. In 2004, there was a study investigating the connection of emotional distress with endometriosis symptoms, and it showed that the surveyed ranked feelings of depression as the sixth most distressing symptom of endometriosis. And this was attributed to the feeling of uncertainty about endometriosis due to a lack of information about the disease made available to patients. In 2011, similar studies showed that 73% of the surveyed reported anxiety and stress as the major symptom that they experienced in their last cycle, and 64% reported depression as the most relevant symptom. So here we have patients of endometriosis reporting psychological symptoms as being more important than the physical ones. A 2013 study on the social and psychological impact of endometriosis concluded that the experience of emotional distress is a key theme in qualitative studies, which show that the majority of women report feeling isolated, depressed, and hopeless. Now, I have to stress that all of these studies always use the word women, but we are obviously referring to biological females, regardless of gender. Just when I'm quoting, I am using the word women because the people that wrote the studies use this term. Then a little bit more recent research in 2016 showed that stress and depression are a result of the fear that chronic pain will interfere with work or personal relationships. And furthermore, the same research showed that among the top conditions that accompany endometriosis are not the ones that I actually listed to you before about the allergies and IBS and thyroid issues, but clinical depression and anxiety. And the very latest report made by the APPG in 2020 states that 90% of the surveyed people would like to get psychological support as part of their endometriosis treatment. So all this points to mental health being a significant area that needs addressing in order to offer endometriosis patients proper care. Now, as is usually the case, when people recognize they're not getting adequate care, they start self-organizing. The same is happening right now with endometriosis, and most of it is taking place online. Because this so-called endometriosis community is so large and widespread, the internet is a natural tool to be used. And what we've seen in the last couple of years is the emergence of a lot of online support groups. Now, just to give you a little idea about the level of popularity that we're talking about here, I'll tell you the numbers for the biggest English-speaking online support groups. There's Women's Reproductive Health Care Support Group, which has 70,300 members. Polycystic Ovary Syndrome Support Group, which has 59,000 members. Endometriosis Support Group with 48,200 members. And I stress again, these are not the only groups out there. They're just the most active groups for English-speaking people. So what goes on in these groups? The most important role of these groups is actually education, because patients are given very little information from medical professionals, and most endometriosis patients are just left very confused and frightened after being diagnosed by an incurable illness. And these online groups suggest that they revolve around sharing information in terms of personal experiences, literature, workshops, and so on. And they're also a place to vent. There are a lot of very intimate conversations that unfold there, because a lot of people feel that they can't talk to the people in their lives about the emotional toll of the illness or how it affects their personal relationships or motivation or mental health, because they feel only people who are going through the same thing can understand and support them, and most of all, believe them. So huge communities are being built over shared fears and anxieties. Now, researchers have obviously picked up on this, and although there hasn't been much interest yet in exploring the topic, the research that has been done supports the idea of online support groups. A 2016 survey about the effects of online support groups has revealed 4 therapeutic benefits. The first one being connection, so connection with people who suffer from the same issues, taking away the feeling of loneliness and being misunderstood and isolation. Then there's exploration, the ability to find information, narration, the ability to share experiences, and lastly, self-representation, the ability to control personal information and one's online persona. The following year, in 2017, there was another study conducted on online support groups and their role in rehabilitating psychiatric patients. Mostly, this had a focus on depression and anxiety disorders. And this research shows that online groups are highly beneficial, and that the peer-to-peer support offered, engaging with others in a safe space and having the option of anonymity, have proven to reduce depression. This is very significant for all chronic illnesses, and research has already revealed a connection between depression and anxiety with endometriosis, as I mentioned earlier. So this is just another supporting argument on why these online support groups are very important for endometriosis patients. This information leads to the problem of work productivity. Recently, researchers have started showing interest in the correlation between endometriosis and work productivity, and in turn, the question poses itself: how does this affect the economy? To put it bluntly, endometriosis costs a lot of money. So let's break that down. First of all, women with endometriosis lose money. Once again, we're talking about an illness that affects 10% of the female population, which is a large amount of the workforce. It is approximated that an average woman suffering from endometriosis is bedridden an average of 17 days per year. This means, if we generalize roughly, that every 10th female employee spends 17 days per year on endometriosis-related sick leave. This is not an insignificant number. Interestingly, multiple international studies have shown that presenteeism is more costly to the company than absenteeism. High levels of presenteeism indicate that women with endometriosis still make an effort to be present at work despite their symptoms, and this leads to impaired work productivity. Women interviewed in 2012 have stated that their fear of getting fired drives them to go to work regardless of the pain they experience. Women report they fear they won't be believed when they report their symptoms to their employers, and that this will lead to contract termination. Furthermore, women largely choose not to disclose their illness during the hiring process because they fear they won't get employment because of endometriosis. But studies have also shown that being present at work leads to a higher level of productivity loss as the employees are in no condition to be working. So this basically means that by being at work, you're doing less than if you just stayed at home and gave your body the rest that it needed. And just because you're physically present doesn't mean you're actually capable of doing the work. You're more productive if you rest and recover and then catch up. Another study that was conducted in 2011 in the USA has shown that on average 6 days a year are lost because of absenteeism and 31 days per year are lost because of presenteeism. The conclusion is that it would be beneficial for all if patients were given the rest days they clearly need. The same study concluded that employers in the USA lost roughly $45.4 billion per year on the inefficiency of endometriosis patients alone. Now, the second cost to be considered is the cost of healthcare. Patients suffering from endometriosis frequently use gynecological services, and this includes procedures such as regular ultrasounds and colposcopies. So they don't just go for a regular gynecological checkup, they have these procedures done on a regular basis that a normal or healthy woman wouldn't need every time. Patients of endometriosis are also regular users of painkillers, and they're very often put on hormonal treatment. All of this amounts to above average use of both healthcare professionals and of medication. The yearly total, which includes direct and indirect costs, of endometriosis has been estimated at 30 billion euros in Europe and $22 billion in the United States. On top of that, we have non-medical costs tied to endometriosis. So first of all, one of the ways endometriosis influences the menstrual cycle is making menstruation have a heavier flow and having it last longer than it does for an average person. This results in higher expenses when it comes to menstrual health products. And secondly, there is non-medical treatment. So what does this entail? As we mentioned earlier, due to the lack of information and adequate care, people have started self-organizing, and with limited medical treatment available for endometriosis, a new trend of lifestyle-based pain management has surfaced among online communities. Nutrition is a particularly popular topic, and the internet is abundant in dietary instruction manuals made by individual patients. And researchers have obviously once again picked up on this trend. And once again, you can find all the research I'm basing my presentation on the final slide of this presentation. So researchers have been testing the influence of diet on endometriosis. And to cut the long story short, the overall conclusion is that in order to lower inflammation in the body and ease the symptoms, it's preferable to eat an organic, gluten-free, sugar-free, plant-based diet. This diet in itself is more expensive than a diet of processed food and refined sugars. So following the dietary trend, there are also exercise trends, with yoga being the only science-backed activity known to alleviate pelvic pain. And furthermore, acupuncture and deep tissue massages are known to reduce muscle tension and reduce inflammation. So these activities are also endometriosis-related trends. So on top of a very specific diet, we have the additional cost of care and treatments which are not considered medical. Taking into consideration the work productivity loss, which results in financial loss, and when we add up the financial costs of maintaining a functional lifestyle with endometriosis, the situation is quite disadvantageous for patients. And saying disadvantageous, by the way, is an understatement if you ask me. So what does this all mean? What is the takeaway? All this data basically just fuels the argument that endometriosis needs to be talked about more. It needs to become a part of basic education. It needs to be a part of sexual education and health education. People being aware of endometriosis would create a safer environment for the patients. The goal would be to eliminate taboo to that extent that someone who suffers from endometriosis feels safe to explicitly say so and ask for the help and care that they need. My personal opinion is that at this point, all those who are in positions of authority, so teachers, managers, anyone who works with people, they should be aware of the condition and they should be able to have an open rapport with their people working under them about endometriosis. As we have seen, what's been done so far, patients living in fear and lying, covering up their illness, that's not working for anyone. Everyone is losing, both the employers and the employees. So we need systemic change that includes endometriosis in open discourse. With this call to action, I will conclude my lecture. I hope that you have found it informative and entertaining. If you would like to follow my work and if you're interested in this topic, you can follow me on Medium, where I'm a writer for the feminist section. And you can also follow me on Instagram. And of course, if you are somebody who's interested in my research or a fellow researcher, you can always reach out via email or by contacting the Worth Institute. Thank you for your attention.